Well, I started in this field, like a lot of people, I fell into it. Actually, my stepfather was an industrial hygienist, and he got me involved in the field, a small consulting firm where I started out doing asbestos fiber counting back in the mid-'80s. And from there, I progressed from consulting into healthcare, and I've been in healthcare for the last 21 years. And it's a wonderful profession. I thought when I was growing up that I would be a physician, but I realized after working in this field, occupational hygiene, industrial hygiene, for many, many years, that I could do more to influence worker health and safety from the position that I was in than a lot of physicians get to do with their patients. The changes that I've seen since I started in industrial hygiene, and I started in the mid-'80s, is we started as really as a profession, at least when I joined, it was really much more compliance-driven, where we're trying to make sure that we're in compliance with OSHA regulations and standards and guidelines that have been established by consensus organizations such as AIHA. But I see where the profession is going, really, and where we need to really think about what we need to be doing is understanding the whole risk management part of occupational exposures. Because, for instance, the work that I do in green building in healthcare has to do with, there's many more resources that are spent on the people that occupy the buildings that are built than there is in the first cost of building those buildings. So it's much more important to make sure that the people that occupy those buildings are healthy and productive than it is to make sure that they're built to be energy efficient when we're talking about the long term of these things. So industrial hygienists or occupational hygienists have an enormous impact to make on the future of the American economy. And it's not just about energy performance of green buildings, it's about whether people are healthy and productive. And aside from that, there's other areas where we can materially impact worker health and safety. And not just because we're in compliance with OSHA regulations, which aren't being updated these days, but are really protective of people's health. And the more that we can really speak to health and wellness for individuals, the better that we'll be able to get our message across about what it is that we do. For people that are just getting into the profession, that where I see the most important thing that you can do is to learn everything about everything. That is, it's not just the narrow technical focus, although of course you've got to be competent in what you're doing, but to understand the connections between what you do and what other people do in order to bring those things together, to have a cohesive kind of holistic look at the working environment and how these problems get solved. Because it's not just going to be your expertise, it's going to be the expertise of everybody around the table in whatever industry that you're working in or whatever occupation that you're working in. You aren't going to be the only go-to person. You need to be able to work with other people. So it's really, really important that you know what you know and you know what you don't know. And the only way you know that is by reading about stuff that interests you. And, make sure that you make time for creative pursuits, because all of that plays into your creative process as a professional as well as an individual.